Hello, this is Scott, and this lecture in the Transgender Health series is on care for the aging transgender patient. One of the largest issues of care for transgender patients is transfer from pediatric to adult clinics. Many youth clinics are specifically designed to help transgender patients and to help with gender dysphoria and mental health concerns, but then these patients lose care as they transfer to adult clinics. Here at UVA, we have the teen health clinic here, which treats patients up to age 26, but then they need to transfer to adult clinics. We are lucky enough to have Dr. Casey here in charge of the adult transgender clinic out in Crozet, and having the new gender health services being set up at Pantops, which with integrated youth and adult transgender clinics. However, this isn't the case in many places in the country. It's especially important with the use of GnRH analogs, where long-term puberty suppression requires specific follow-up, especially as it relates to bone mineral density. Adult clinics may be unprepared to provide this kind of monitoring. Many transgender patients have comorbid anxiety and depression related to gender dysphoria that require ongoing medical management and mental health referral. And some of these adult transgender clinics might not be well equipped to take on new patients with these kind of mental health comorbidities. A 2018 review of transgender care found that there were little to no studies on handoff of care and resultant outcomes. High rates of substance abuse, homelessness, and incarceration amongst transgender youth were identified as barriers to care, which affects transfer to adult physicians. A 2009 study in New York on transgender females and a 2017 study of Canadian transgender adolescents and young adults found that access to a knowledgeable healthcare provider were major barriers to follow-up of care. Also, access to knowledgeable healthcare providers, if you remember back from the social determinants of health lecture, had a major association with lifetime risk of suicide. It's very important that transgender patients are able to be set up with healthcare providers that they trust. With high rates of anxiety and depression, along with risks and required follow-up of hormone therapy, continuity of care is of utmost importance and is a major issue to care for transgender youth and adults. The geriatric transgender population is unique and is only now recently coming into light as a population of study, as many aging transgender patients are the first generation to truly be out and transgender. Combined with specific medical needs of transgender patients along with specific needs of geriatric patients, there's a unique challenge of medical management. With regards to hormone therapy, transgender women are at higher risk of VTE, cardiovascular disease, and cerebral artery disease due to the thrombophilic effects of estrogen. Combined with the cardiac risk factors associated with aging, it's reasonable to transition to transdermal estrogen due to its relatively safer side effect profile. However, this must be discussed with the patient, as many patients are very resistant to stopping their hormone therapy. Patients on testosterone may need dose adjustment in the setting of erythrocytosis or cardiac insufficiency. However, currently there are no studies showing long-term effects on cardiovascular mortality as it relates to use of testosterone. The 2020 Trans-Pacific Geriatric Health Assessment was the first of its kind to really address health for the aging transgender patient. Currently, they found no risk of increased rates of osteoporosis with prolonged hormone therapy. However, bone density scans are recommended based on other risk factors. There's a theoretical risk on the cessation of estrogen therapy, especially if a patient has undergone orchiectomy. Polypharmacy is a huge issue amongst geriatrics in general, and Beer's criteria does not really address how hormone replacement therapy affects polypharmacy in the transgender geriatric population. Hormone therapy may also affect sleep quality, as it's shown in cisgender women who are on HRT to cause sleep disturbance. Transgender patients have higher rates of PTSD and depression, which can also affect sleep. Low levels of sleep and poor quality of sleep are both associated with delirium, and delirium has poor health outcomes in general. Transgender men who undergo mastectomy still have residual breast tissue, as discussed in the transgender health screening PRL, and transgender women on estrogens have increased risk of breast cancer, as opposed to age-matched cisgender men. Both transgender men and women may be screened for breast cancer based on age-matched cisgender women guidelines per the 2019 population study talked about in the trans health screening lecture. Activities of daily living screening tools should also include the ability to self-administer gender-affirming hormones and the ability to manage potential urinary complications associated with gender-affirming surgery. The needs for these patients to undergo these activities of daily living should be addressed as it relates to an appropriate medical and surgical history. Shown here is a chart that just goes over some of the urogenital, psychiatric, and hormone therapy evaluations that are specific to transgender men and women. And here are some preventative care needs for cancer, cardiovascular, musculoskeletal, and metabolic disorders for both transgender women and men. Elder abuse is a huge issue in the transgender population, as there's increased rates of abuse and harassment in general amongst transgender people. It's an unfortunate phenomenon that can take place from anyone from a family caretaker to an institutional worker. Up to 9% of elders reported being abused or neglected by a caretaker because of homophobia, and 9% experienced blackmail or financial exploitation. It's very important to screen for elder abuse amongst the transgender population, as there's a very high rates of abuse and exploitation. The LGBT Aging Center posts a checklist for transgender care, and this is just a way to make sure that a facility is well equipped to take care of transgender patients. This ranges from things such as using correct pronouns, allowing patients to use rooms and facilities that align with their gender identity, respecting privacy, and that only staff that manage medications should know about hormone replacement therapy or gender-affirming therapy. And staff managing assistive care, such as bathing and dressing, should be trained on professional management of transgender patients. It's also important to take a look at how staff, especially ones who might be billing, and look how they address patients by their birth name or by their preferred name. It's appropriate to ask what name is appropriate for billing, but not to ask what your real name is. That's very offensive to transgender patients. It's important that everyone that's taking care of this patient is adequately trained and able to be as respectful and give the best care possible. The National Resource Center on LGBT Aging and the Services and Advocacy for Gay, Lesbian, Bisexual, and Transgender Elders are two groups that have excellent resources available for elderly LGBT plus persons. Ultimately, there's little information on the transition of transgender care between clinics or care for transgender geriatric patients. Although the 2020 Trans-Pacific Geriatric Health Assessment provides a framework for treatment of elderly transgender patients. It's a step in the right direction. However, there's a lot of work that needs to be done to make sure that transgender patients of all ages receive the care that they need.